Have you ever seen a blood sample that looks pink or red instead of that nice golden yellow serum? Looks pretty, right? Well, that beauty is actually a disaster. That's hemolysis, one of the most common reasons why labs reject samples. But what exactly happens when red cells burst? Why does it mess up your reports? And most importantly, how can you prevent it like a pro MLT? Let's uncover the science behind this tiny, but mighty, problem. So, hemolysis basically means the breaking down of red blood cells RBCs, and when they burst, they release hemoglobin into the surrounding plasma or serum. Now normally, a clear serum looks pale yellow, but when hemolysis happens, it turns pink, red, or even brownish. That color change is your first visual clue that something went wrong. Actually, there are two main types of hemolysis. 1. In vivo hemolysis. This happens inside the body, due to diseases like hemolytic anemia or immune reactions. And in vitro hemolysis, the one we are talking about, this happens outside the body, because of errors during blood collection or handling. And trust me, in the lab, 90% of hemolysis is our own doing. Let's talk about the real culprits. Hemolysis doesn't just happen, it's usually caused by poor technique or carelessness. During blood collection, there are 5 probable reasons that cause hemolysis, and they are: using a tiny needle like 25 gauge because RBCs hate pressure and burst easily; pulling the syringe plunger too fast, it's like vacuuming your red cells; shaking tubes too hard instead of gentle mixing; not letting the alcohol dry before puncture, yes, that matters; drawing from a hematoma or with too much tourniquet time. Hemolysis can also occur during handling and transport. I will tell you how. Basically, if the sample travels like it's in a roller coaster ride, hemolysis is guaranteed. Now here's the scary part: hemolysis can completely ruin your test results. When red cells burst, they release potassium, LDH, AST, and other enzymes. So these levels appear falsely high. At the same time, tests like haptoglobin or bilirubin can show falsely low values. And colorimetric tests? Forget it. Free hemoglobin changes the sample's color and affects light absorbance. So if a hemolyzed sample is reported, the patient might get the wrong treatment. That's why professional labs reject hemolyzed samples immediately. Alright, time to talk solutions. How do we stop this tiny villain? Here's your anti-hemolysis checklist. Use the right needle gauge, 21 to 23 gauge is best. Let alcohol dry before puncture. Never pull the plunger forcefully, let blood flow naturally. Mix tubes gently, invert 5 to 8 times, don't shake. Allow proper clotting before centrifugation, 20 to 30 minutes. Separate serum or plasma promptly, ideally within 2 hours. Handle every sample as if it's gold, because for the patient, it actually is. So let's quickly wrap it up. Hemolysis equals small steps that make big difference. One calm hand can save an entire report. RBC destruction. It occurs due to poor technique or rough handling. And it guarantees false results, wasted time, wrong diagnosis. Prevention equals gentle hands, careful process, and attention to detail. In short, handle blood like life depends on it, because it does. If you found this helpful, hit the like button, share it with your fellow MLTs, and don't forget to subscribe. We've got plenty more lab secrets coming your way. Stay accurate, stay clean, and keep those cells intact.